It's an illness many people still suffer through in silence. July is National Minority Mental Health Awareness Month, and it's a time to lift the veil on issues that too often go unseen and unaddressed.
From historic inequities to modern stigmas, mental health in the Black community comes with layers that deserve a louder voice. And joining us now is Dr. Sharon Lawrence, founder and lead therapist at Selah Wellness and Therapeutic Services. Dr. Lawrence, thanks so much for joining us.
Thank you for having me.
All right, so can you tell us, why is this month so important for the Black community?
It's an excellent question across the board, because we need people to know that we are impacted like any other demographic, any other ethnicity. There's so many things happening in the communities that is not often recognized, acknowledged, told about, which I'm appreciative of you for doing this segment. And so a lot of times people often believe that we're exempt from a lot of things that are happening and the impact from those things that are happening in the world and just in our communities.
Well, Doc, there's a phrase, and it goes checking in with yourself. What does that really mean, and why does it matter?
Paying attention to yourself. It means that you are a priority like anyone else. I think one of the biggest concerns that I often see is that we're helpers. And we often will step in to support family, friends, colleagues, anyone in our communities. But when we often see where there's a need, we don't envision ourselves in front of us as well. And so when we don't pay attention to what we need, there's often a lapse in care, a lapse in self-prioritization, which means that if you're not filling your cup, how can you truly be effective at helping someone else? And so you have to be willing to see how you're feeling, what you're thinking, what your energy level is. Are you eating? Are you drinking water? Are you moving, exercising, sleeping, right? Connecting with people, having impactful relationships and connections. And so making sure that your needs are met, similar to when we think about Maslow's hierarchy of needs. Are you getting your basic needs met the same way you would encourage someone else to do so?
And what are some common mental health challenges that Black Americans or Black people face?
The list is very long. I would say one of the things is a lack of access to resources. One of the things is that we're finding is that even though we know that resources exist, not everyone has the ability to get to those resources. They may not have medical coverage. Some people are not aware about some of the things that are available in their communities, whether it's not being marketed accordingly, or they're just not privy to, or they think that they don't qualify for certain services. I know we may talk about stigma at some point, but that's another thing. People feel ashamed. And so based on what people may be saying to them, they may be afraid to connect to resources as well.
Well, how do we get, you talk about stigmatizing someone, being stigmatized. How do we get beyond that?
You got to do what's best for you, honestly. I think if we can continue shutting down, when people are saying things as if suicide or mental health or mental illness is not normal, we need to normalize those discussions. So when someone is saying something negative, be quick to correct them. And you can do so in love, you can do so in kindness, use it as an educative moment, but allow them to understand that, hey, you never know who is going through something. So be mindful of your words, be mindful of your statements, or even your judgments and opinions, because that may be the very thing that will stop someone from seeking the help that they may need, whether it's on a mild level or a significant severe level. And so I think the first thing is about the language and how we connect with individuals. We want to make sure that people are mindful of what their statements are, but also getting the information. There's, mental health first aid trainings out there that help with this as well. But there's tons of information on the internet. Me and my husband always say you can Google anything, but just a sense of kindness, if you will, getting that information and being mindful of how you speak about things, but also how you share that information so that it will encourage someone and not cause them to retreat from seeking the help that they may necessarily need in that moment.
Now, when it comes to looking for therapy, some people may not have the money that, is needed for those services, but what are some ways that you say we should go about looking for services that are right for us?
Well, the first thing is it's like a job interview. I tell anyone, ask the right questions, because this is the person that you're going to be sharing information with, that you're trusting with your care. And so just as if, just like that clinician is asking you questions, or that therapist is asking you questions, also ask them questions. Do they specialize in what it is that you're dealing with? How long have they been in practice? You can also ask about their schooling, if you will. Do they take your insurance? If you don't have insurance, are they familiar with other resources that may provide uninsured services for you? And so you want to make sure that that person can answer your questions and that you feel comfortable with them, so that you don't feel like you just have to kind of step into that process with them and say, okay, I'm going to show up. This is the one. If it doesn't feel right, you can definitely say, hey, I want to be able to move on and maybe connect with another provider. And that's okay as well. And sometimes providers will do that as well if they don't feel like clinically it's a good fit, or if there's a higher level of care that may be needed, they may refer that individual out.
All right. Dr. Lawrence, thanks so much for joining us.
Thank you.
And for more information on the organization, visit myselahwellness.com.